Hello and welcome to this week's edition of City View. My name is Mayor Tom Koch. Today I'm joined with Laura Martin. I'll be later joined by Jim Timmons, our city solicitor. And as you know, the last two shows we've been out of the studio, out of the office a bit. The weather today, though, is a little lousy outside, so we're back in the office today. But we want to continue to bring to you important information, vital information, as we continue to move the city forward. And we've talked a lot about infrastructure in downtown, and those are important issues, but a city is far more than brick and mortar. And one of the biggest challenges we face today, not only in Quincy but across the Commonwealth, is the addiction issue, the abuse of opioids and what's gone on in our society. A few years back when I took over as mayor, we formed a task force and brought a lot of people to the table, people that were working hard on this issue, but we weren't working together so much on the issue. So working with our police department, our school department, the sheriff's office, the DA's office, independent organization, nonprofits, health organizations, Bay State Community, Man of Health, and so many others that have come to the table at offering their expertise as we continue to face this issue as a community. So in this, I guess about a year ago, maybe a year and a half ago, we made a decision we needed really a full-time coordinator to really bring it all together on behalf of the city, and it didn't take long for me to find the right person for the job. Laura Martin is a lawyer by trade. She worked as an assistant district attorney for a period of time. She has personal experience on this issue, losing a sibling to this a number of years back. Laura's brought some great energy, enthusiasm, and terrific background so that we as a city can be more forward-thinking as well as trying to stay on top of this issue, bringing everybody together. So Laura, I thank you for all your work to date. I know it's still early for you, but I think you've done a remarkable job since joining us. And that's to add to all the good work a lot of people have been doing, whether it's the drug unit or the police department on the enforcement side, whether it's the MARP appeal and the school folks and the health interventionists, the nurses, all on the education side. And of course, we have a great relationship with so many folks on the treatment side, as we know. So we try to attack it from all angles, as you know. But let's talk a little bit about, maybe you could talk a little bit about your story and why you said yes to me for this job.
Sure. So thank you for the opportunity. I think I said that when you offered me the job. Being a lawyer by trade, I wouldn't necessarily think that I would find myself in this role, but I think life kind of leads you to where you should be. So growing up, I always wanted to be an attorney. I wanted to be an attorney with my brother, who we lost about 13 years ago, and we were going to help people. So then he passed away, and I went on, and I wanted to, I'd seen the scourge of addiction and what had happened, going through the struggles with my brother, and I thought that my role was going to be attacking, from the healthcare perspective, getting people treatment. And so I did a number of jobs where I worked with a law firm in town, working with hospitals, and then I did a nonprofit, and I was seeing that I was doing a lot of stuff, but I really wasn't having much of an impact hands-on. And for me, the best part of my job is that the rewards for me are unseen by other people. It's helping a family member, it's giving a piece of advice, but more importantly, it's just lending an ear for someone that's gone through it, or I've seen my parents gone through, what addiction does, and really realizing it's a family illness, it's a societal illness, and the solution has to come from all of those. So I found myself in the drug court, and it was awesome to see lives change by just giving people a shot. But I think I saw that within those four walls of the confines of the courthouse, we couldn't solve the problem. So I came to you and asked if you would allow me and my friend Nancy to start the Quincy Task Force. And the goal of that was to add on to what was going on in the mayor's task force and kind of get out there and have kids in real recovery and, the drug unit guys talking to parents and children. So that was kind of when I realized that I could do a lot more in the community in this field without just focusing on the legal stuff. That's always going to be a part of it, but it really comes down to the addiction, just like any other illness. And now that we're recognizing substance use disorder as an addiction, and even substance use disorder, that's what we're calling it now, changing the language. And when you change the language of something, and when you have highly educated people talking about what it now is as a brain disease and something we're going to treat like a disease, you look at it from the disease model, just as you would if you had a loved one that had cancer or some other illness. It's individual. So for me, coming here, and what I've been doing is really trying to navigate all the great services that are in Quincy and to align us and to see where the strengths are with certain agencies, and to not try to have City Hall repeat that, and to see where the missing links are on education and where I can support the school system and where maybe it's not the appropriate venue. And then we look at having a community event and a community training. So for me, it's been a year, and it's been a year of learning where I can best offer guidance and allowing people to do their jobs, but also bringing new and innovative ideas together where in the past, not just the police, not just the schools, they can't battle this.
That's true. Let's talk about that for a minute, just by way of background. You mentioned your friend Nancy, and Nancy Haller has shared her story publicly on a number of occasions with losing her son. Nancy's been a tremendous advocate, as you know, for a long time. She was one of the first people that I ran into when I was running for mayor the first time in '07, who shared that story of her son with me, and I had not realized the depth of this issue. Now, I'm a lifelong Quincy guy. I've been involved, long before I was mayor, I was involved in a lot of organizations in the community, 3 kids, and I wasn't aware of the depth of this issue. So it was people like Nancy that really educated me on firsthand what was going on in our community. And one of the first things she came to me, her and her husband at the time, come up and said, we carry Narcan at home because of our son's issue. Why don't the first responders? So that's a good question. Let me talk to my chiefs about it. And the police chief at the time, Chief Keenan, said, let's do it. We'll get our guys trained. And the police department went on to do it. We became the first community in the country to do this. Now, since that time, Brewster and our fire department also carry it and serve those people who, when they come on the scene. And that's been over 700 saves since we instituted that. So that was like one little piece. The drug drop-off day became a popular issue where we focused a couple of years on the monsters in the medicine cabinet, really, and for parents to realize when you have leftover medication, don't leave them around. That's a temptation for somebody, because all it takes is that one bad choice or decision somebody makes, and it could be a lifetime or a journey of really horrible stories and tragedy. So that was one piece. And on the school side, I know you've had the opportunity to work with Maura Papil and some of the great people in our school system. We've been adding into the curriculum. In fact, the most recent thing, which was very exciting, I thought, was Blue Cross sponsoring a medical doctor to speak to our science departments about working in to our curriculum about what it does to the brain when you start down this road with these chemicals. So we're trying to attack it from every possible angle. And I certainly want people to understand that, we're not the be-all, end-all, but we recognize this as an issue for the community, and we spend a lot of resources, a lot of time and energy on this issue over the last several years. And we'll continue to do that until we continue to make that difference. And I know you started to say, you listen to people, you try to guide people and get them help. We'll never know the success because you can't measure it. One of the stats, though, that has been very disturbing over the years is obviously the deaths rising each and every year. This year we're seeing a level off or even a little bit of a downturn. Can you share some of that information you're seeing?
The report came out today and that's your point, education and awareness. You heard from Nancy that they needed the Narcan, and so now we're saving lives, and the police were willing to, Chief Keenan, and implement it. And it's really everyone working together, trying to get people into treatment. We're seeing, fentanyl, it's so much more powerful, so their overdoses are up. But people are being saved because we're educating the community. We're having a community training on Narcan. Our police are going out after overdoses with Manic Community Health to train loved ones on Narcan. So everyone now knows about this life-saving drug. 13 years ago, I didn't know what Narcan was. Now I have it, and I have it with me. And people do. And so people are taking on that responsibility because you stepped out and said, we have this tool, why are we not using it? So I think it is trending down for the deaths. The overdoses are up because it's a catch-22. More people are getting treatment. So when they come out of treatment, their susceptibility to overdose when they go back to that same dosage is
Don't
higher.
you think we're turning the corner too on the stigma issue?
Yeah.
I mean, I see.
Because we're talking.
That's right. And I've been to a lot of, way too many wakes. And I have noticed the last couple of years that families actually talk about in the obituary somebody struggled with addiction rather than just that old line of died unexpectedly or died at home. So that they could share their sorrow in the immediate form, but share their concern and information so that maybe it helps somebody else. So.
And we're sharing, and you're so right. I mean, part of my role isn't just, of course, I work for you and representing the city, but it's as a sister and as someone that's gone through it and knows that, I go and speak for you and represent that in this city, you're not ignoring this issue, but we're not saying we can solve it, but we can educate everyone and working together. I really think the impact is amazing. And you have the police and Manit doing those home visits together. That wasn't happening before. And the police taking their own initiative and now wanting to do more. And people are seeing the impact. And the more they see the impact, the more they're going to want to get involved. And people are going to want to speak out and say,
And you've been saying to me, we've got to spend more on prevention. More resources, more time, and I know that's something you've been attacking.
Because it's a scary, scary thing to try to get off it, but if we can stop it and educate people, then you can't scare people out of it, but you can educate them, which is perfect with the curriculum, and that's what they do in the schools. They educate kids. So now they'll educate them about the warnings, just like they do with bullying and other things, and I think it's very progressive, and it's needed.
It's been it has been remarkable, the amount of effort and the spirit by which the people that are involved in this issue, that you can see the compassion they have for people, including yourself. So the other piece that we talked about early on was a lack of beds and treatment. And a couple of years ago, we supported publicly the opening of the Phoenix House, which I know cost me politically a little bit because a lot of folks are not in our backyard. But at that hearing, we talked about it, and these are our kids. These are our neighbors. These are our families. That I had been given a stat a few years ago that any time course of the year, somewhere between 3,000 and 4,000 people from Quincy are in treatment somewhere. So and we didn't have a treatment facility in Quincy. So I'm glad we have one because that was one of the missing links that we had. I know that they're going through a little bit of a transition right now, but I know with the Gavin House's involvement, John McGann, and his leadership, we can continue to provide services at that location. So we've got a couple of minutes left, Laura. Any important information you want to share with those viewing today about this issue? Perhaps a phone number or two, and give them some guidance.
Absolutely. Well, I just want you to know it's an open door. The help or guidance I give you isn't shared with anyone. That's the mayor's, set me up to provide resources to the city, but always anonymous if anyone needs help. My email is lmartin@quincyma.gov. And, just ask. We have so many resources here, and we're really trying to pull everyone together as a community. And we're going to revamp the website, but that email, until the website is up, is where you can go to ask anything. And everyone should remember that no question is stupid in this. You're safer to ask than to wonder.
Good teacher always said that. There are no stupid questions.
No stupid questions, especially in this where it can save a life.
Well, Laura, I appreciate you joining me today. Appreciate all the good work you're doing on behalf of our citizens.
I appreciate your support.
Joining me now for today's show is our esteemed city solicitor, Jim Timmons, who's been my solicitor since I've been in office and served a number of years as assistant city solicitor under Jim Sheets. So he's had a lot of municipal experience as well as experience in the private sector in his practice as well. So one of the aspects of the drug issue or the addiction issue that is now coming to light is that of the responsibility that the pharmaceuticals may have had, or I believe have had, in the creation of the availability or the flooding of the market, if you will, of the availability of painkillers. So we've talked a lot about today with Laura Martin about some of those things we're doing as a city, education through the school system, law enforcement-wise with our police department, DA, and sheriffs. And the treatment side, working with the Phoenix House and the Gavin Foundation and so many others. But there's an area that after several discussions I know internally about what else can we do, the solicitor and I had some discussions, and we've now engaged with an outside firm to really go after the pharmaceuticals for what I believe is their responsibility in creating some of this issue. So, Jim, maybe you can talk a little bit about that, who we've engaged with, and I should say right up front that it's not costing the taxpayers any money at all. This is something that the company would be paid for through any awards that would be accrued through any litigation. So maybe you could talk a little bit about the company and a little bit about the process, Jim.
Sure, Mayor. We've engaged a firm out of Washington, D.C. Named Motley Rice, and the particular attorney that we're going to work with is attorney Linda Singer. She's the former Attorney General of the District of Columbia, as you know. And in making the selection, we've had several firms speak with us about this once they knew of our interest. And in making this particular selection, we felt that Linda Singer was a great selection because of her background as a former Attorney General, because there's a lot of dynamics in play here. Our Attorney General, Maura Healey, is involved with several other attorneys general across the country, right, engaging in litigation. We wanted to have a more particular type of litigation filed where it's the city of Quincy and the city's interests that are being asserted. And also, as you discussed, if more communities will do this and more people go after this industry and this problem, then we can actually start to affect some solutions and some change. So that's what we're trying to do here. We think Linda Singer's a great selection. She's already shown that in a lot of our preliminary discussions because she's got great awareness about what the role of government is. Just by way of example, normally one would think that our role in the opioid crisis would be fire department, ambulance, first responders, the police arresting drug dealers, et cetera. Well, what we're doing, which is a little different, is we're going in as what's called kind of like a market participant. We're saying that the city of Quincy is spending a lot of money here and sustaining a lot of damages as a result of this problem. So we're going after the parties that we think are responsible for the reasons that you stated on the
and by the way, those are resources and money that we'll continue to spend because it's that important. We don't apologize for the resources that we put out for this because it's an issue that's affects virtually every neighborhood of our city. So, do you want to talk? Do you look at this potential? Well, it will be some litigation at some point. Do you see this mirroring what happened with the tobacco industry? Some similarities?
Yeah. It's pretty much exactly the same type of litigation. What we're talking about here is what they call mass tort litigation. And what that means is, unlike a car accident case where basically the driver gets sued by the injured other driver or passenger or pedestrian, where it's kind of a one-on-one lawsuit, what we're talking about is a far more widespread impact, similar to what smoking did in terms of its impacts on public health over the past several decades. So what we're saying here is this opioid crisis, which we've really developed knowledge about over the past, say, 5 to 8 years through this type of litigation. What's happened is that in other parts of the country, there are some suits in West Virginia. I know the city of Chicago has filed a similar lawsuit. And through the processes of those lawsuits, lawyers and the public have learned about what exactly has gone on. So we're doing precisely what was done on the tobacco litigation, is we're not just trying to get money from the manufacturers and distributors, we're trying to affect social change that's going to help to end this crisis, because although the city may be able to get money back for sending a fire truck to a response scene where there's an overdose, what we're really trying to do is, as you have said on many occasions, Mayor, is have the need for that fire truck going to that scene ended. We're trying to get involved in solving the crisis, not just reacting to it.
And we've heard, you know, everybody has a story when it comes to the addiction issue. Everybody, and because everybody's been touched by it. But the availability and the ease by which people could access these pills, it was just incredible. And that's something I learned early on being mayor, listening to folks and the stories. And, you know, somebody get injured, they get prescribed some oxy. Somebody goes to the dentist and they get, you know, 30 perks or whatever. And it begins that journey of that person down this horrible scourge of addiction. It's mind-boggling to me how, and I've used this term, I think it was in the Globe, how loosey-goosey it's been for this type of heavy pain medication. You know, and I talked a little bit about it in general, but it's been, there've been few restrictions right down the line, right down the medical profession. And I just think that the demand for easing that pain, whatever it may be, overshadowed perhaps what could lead down the road by taking these pills. So it has been troubling, and I'm so pleased that we are joining in this. I think we're certainly the first city in Massachusetts, I think, to do it. I know you mentioned a couple of cities. I think there's a couple of the states that they're also representing. So do we have a time frame on this? I know we're in the information gathering stage. Is that fair?
Yes, we have a lot of work ahead of us, but with Laura Martin on board, and I know you said you talked to her earlier, and the experience we've had in Quincy, which is that the police department's been involved with Narcan since early on in your administration, when you made the determination that we were going to bring that in as a tool for our first responders. What year was that approximately?
That would have been the fall of 2010, and that was a suggestion of we talked a little bit about it earlier. Nancy Holler come up to see me. They had it in the medicine cabinet as a family. Why don't the first responders carry it? And we posed the question to the chiefs, and Chief Keenan jumped right on it, and now the fire department does it as well. We've had over 700 saves since we first started that program. So it's been, again, one of the tools in the tool chest, if you will, in this issue, because we've been attacking it from so many different angles. But this is a new angle.
Right.
This is something that I know that you and I have both been getting a lot of response about.
Yes, a very positive response from people who have had these situations where, you know, you go to a doctor and you're given a prescription for 30 oxycodone, and you're like, why do I need it? I once represented someone who was out on workers' comp, and it wasn't enough for him to support his family. He was given prescription pain medication, oxycodone, and what he started doing was selling that to supplement his income. He wasn't using it for the medical purpose, he was selling it to supplement his income, and he was caught by the Quincy Police Drug Unit. I mean, that's a tragic story. This was someone who had a good job, was out working hard, and his life went in a terrible downward turn. And so that's what we're trying to do, but we need to tie together with specificity the impacts here in Quincy. You know, how many times Narcan's been used by the police department, and what the circumstances were. Because the fact that there's this, you know, burgeoning awareness of what's gone on with the opioid manufacturers, we have to tie that with particularity to what's happening here in Quincy. And Linda Singer and her firm feels very confident that they can do so. We've been working for the past several weeks starting to gather information. And what'll happen is there'll be a vetting process. We'll have to supplement, because one of the things the manufacturers and distributors that we've been defending have done is they've really vigorously defended these cases. They've attacked them on several fronts. One of the things you mentioned...
Just like they did in the tobacco cases, right?
Correct, correct. And ultimately, what happens is, and this is one of the issues, I generally speaking, I understand why people have the perception of personal injury lawyers, or, you know, tort lawyers they're called, that they have, because most think that they're out there just trying to grab a buck. But in the mass tort realm, the closest analogy is what happened with the tobacco industry. That's the type of thing we're getting involved with, and we're getting in early as one of the first. You know, Quincy's a major city, but it's not a metropolitan venue like Chicago and some of the others.
Right.
And what happened was the lawyers had to go to those communities because the damage number was so high that they could then afford to bring the claim. they're now looking for cities our size who want to get involved in it. And it's going to be a lot of work, but we're going to do it because it's an important issue. And I think it's going to, it represents terrific leadership on your part, because already I've been contacted by several other lawyers in the Commonwealth who will join in. And the more of us who do that and tell, right now, the pharmaceutical companies have to deal with Quincy. Hopefully in 6 months, they'll be dealing with several other communities from Massachusetts, from Rhode Island, other places in New England that are coming forward as well. And when that happens, that's what gets them to the table and starting to work towards solutions. And it's not just paying money, but there have to be some real solutions here.
I agree with you that our first and foremost priority here is to make social change. So the habits change of these companies. But with all due respect to our state and Maury Haley and all, we saw what happened with the tobacco grant monies, and by going it this route, we will then be able to direct some, through the litigation, potentially through the damages, that we will get some resources directly back to our city, which then could help us with this issue in the schools and police and other places. So
where the rubber hits the road.
Absolutely.
My first conversation with Laura Martin was very enlightening for me. I had a couple of thoughts. I wanted to run them by her, and I learned so much in 5 minutes about things that I didn't realize. And you're able to sit with families that have actually been impacted. And the thing that impressed me the most during our initial conversation, and when I say impress me, what I mean is made an impression on me, what you said about what we're here about, is what we're really trying to do is create an environment in Quincy where we're not responding to these situations, but that you can say in a couple of years, and some of the families can say, that we're responding less. Yeah. It'll never be we're not responding at all, but we're responding less because of efforts we took. Absolutely. And I know that's the long-term goal.
Well, I appreciate your help on this, and appreciate you joining me today, Jim, on our weekly City View, which we've kind of revamped a little bit over the last few weeks. We're doing more site visits, but the weather wasn't too hot today, too good to be outside, so appreciate you joining. Jim does a great job for us in the city of Quincy, running all things legal, and that can be very interesting at the city level. And I want you to know that his coat is buttoned and mine isn't, because his coat is cut up the backside, so he can button it easily. But
I have as much to hide. I'm just hiding it, and you chose not to. Yeah.
Again, I want to thank you, Jim, for joining us. I'm sure we'll be, from time to time, perhaps reporting some updates on this.
I'd be delighted to. Yeah, it's an important issue.
Well, thank you for joining us on this week's City View. Looking forward to see you next time.